Assalamu alaikum. In this part of our lecture, we will start to discuss the region over the back of the knee joint, which is called popliteal fossa. It is a diamond-shaped intermuscular space that's situated in the back of the knee, and it contains popliteal vessels, small saphenous vein, common peroneal nerve and tibial nerve, posterior cutaneous nerve of thigh, genicular branch of obturator nerve, connective tissues, and lymph nodes. Boundaries of popliteal fossa. Since it is diamond shaped, so it has 4 borders, and these borders may be described as lateral borders and medial borders. So laterally, the biceps femoris muscle lying above and the lateral head of gastrocnemius muscle and plantaris muscle lying below. From the medial border, medially, the semimembranosus and semitendinosus muscle above and the medial head of gastrocnemius muscle below. And this figure describe what we are talking about. This is the popliteal fossa. It is diamond shaped, so 4 bordered. These borders divided into medial borders and lateral borders, and each borders divided into upper part and lower part. So on the lateral border of the popliteal fossa, above biceps femoris muscle, below lateral head of gastrocnemius muscle and plantaris muscle. From the medial side, also it is divided above and below. Above is semitendinosus muscle and semimembranosus muscle. Below is the medial head of gastrocnemius muscle. The same above, laterally, biceps femoris muscle. Below is lateral head of gastrocnemius muscle and plantaris muscle. On the medial side, above semitendinosus muscle and semimembranosus muscle. Below is medial head of gastrocnemius muscle. Here, the lower border have been dissected and removed. It has an anterior wall or floor, which is formed by popliteal surface of the femur, the posterior ligament of the knee joint, and the popliteus muscle. It has a roof, which is formed by skin, superficial fascia, and the fascia of thigh. For the content of the popliteal fossa first is the popliteal artery. It is deeply placed within the fossa and entering the popliteal fossa through the opening in the adductor magnus muscle, which is called adductor hiatus, as a continuation of femoral artery, and it ends at the level of the lower border of the popliteus muscle by dividing into anterior and posterior tibial arteries. Relation of the popliteal artery within the popliteal fossa. Anteriorly, there is the popliteal surface of the femur, the knee joint, and the popliteus muscle. Posteriorly, the popliteal vein and the tibial nerve, fascia, and skin. Branches of the popliteal artery within the popliteal fossa. Muscular branches and articular branches to the knee joint. Second content is the popliteal vein. This vein is formed by the junction of the vena comitants of the anterior and posterior tibial arteries at the lower border of the popliteus muscle on the medial side of the popliteal artery. As the vein ascends up through the popliteal fossa, it crosses behind the popliteal artery so that it comes to lies on its lateral side. This means that the artery have been moved or passed from medial side of the popliteal artery, then behind, and finally become on the lateral side of the artery. Then it passes through the opening in the adductor magnus muscle to become the femoral vein. Tributaries of the popliteal veins are small saphenous vein, veins that are corresponding to the branches given off by the artery. Arterial anastomosis around the knee joint, and these anastomoses are present to compensate for narrowing of the popliteal artery, which occur during extreme movement, like extreme flexion of the knee joint. Around the knee joint, there is a profuse anastomosis of small branches of femoral artery with muscular and articular branches of the popliteal artery, and also with branches of the anterior and posterior tibial arteries. Third content are lymph nodes, which are called popliteal lymph nodes. They are about 6 in number. 6 lymph nodes are present or ا.م.د in the fatty connective tissue of the popliteal fossa. They receive superficial lymphatic vessel from lateral side of the foot and the leg, and they are accompanies the small saphenous vein into the popliteal fossa. They also receive lymphatics from the knee joint and from deep lymphatic vessels accompanying the anterior and posterior tibial arteries. The fourth type of the contents within the popliteal fossa are the nerves. And the first nerve in the popliteal fossa is the tibial nerve. This is the larger terminal branch of sciatic nerve. The tibial nerve arises in the lower third of thigh and it runs downwards through the popliteal fossa, lying first on the lateral side of the popliteal artery, then passes posterior to the artery and finally become medial to it. The popliteal vein lies between the nerve and the artery throughout its course. The nerve enters the posterior compartment of the leg by passing beneath a muscle called soleus muscle. Branches of the tibial nerve in the popliteal fossa are first cutaneous branches called sural nerve, passes to the skin of the calf and the back of the leg. Second type of branches are muscular branches, and the third type of branches are articular branches to the knee joint. The second nerve in the popliteal fossa is common peroneal nerve. This is the smaller terminal branch of the sciatic nerve. The common peroneal nerve arises in the lower third of the thigh and runs downwards through the popliteal fossa, closely following the medial border of biceps muscle. The common peroneal nerve leaves the fossa by crossing superficial to the lateral head of the gastrocnemius muscle. Then it passes behind the head of the fibula and winds or running laterally around the neck of the fibula, pierces through peroneus longus muscle, and here it divides into its two terminal branches, which are the superficial peroneal nerve and the deep peroneal nerve. As the nerve lies on the lateral aspect of the neck of the fibula, it is subcutaneous and it can be easily palpated by rolling against the bone. Branches of the common peroneal nerve within the popliteal fossa. First, cutaneous branches like sural communicating branch and lateral cutaneous nerve of the calf. Second type of branches are muscular branches, and the third type of branches are articular branches to the knee joint. A third nerve present in the popliteal fossa is posterior cutaneous nerve of thigh. As you know, this is a branch of the sacral plexus and it passes through the back of the thigh and it terminates by supplying the skin over the popliteal fossa. And the fourth nerve within the popliteal fossa is the obturator nerve, which is a branch of the lateral cordobrachial, which is a branch of lumbar plexus and it is responsible for supplying the muscle of the medial compartment of thigh. This nerve terminates in the popliteal fossa by supplying the knee joint. Thank you.